The difference with the sleeve compared to the gastric bypass is that there's no malabsorptive component to the surgery. It avoids some of the long-term issues that can happen with the gastric bypass. In particular, there are very few vitamin and mineral deficiencies later because everything goes down the normal way. The gold standard operation, of course, is the gastric bypass. It's been around for 50 years. It has very predictable weight loss. What we're seeing is patients who are a year out from surgery who've lost 60, 70, or 80% of their extra body weight.
Well, I had what's called the Roux-en-Y, is where they make a small pouch out of the stomach and they divert part of the intestines so that I have a little bit of malabsorption. So I have to supplement my diet with several vitamins that would otherwise not be absorbed through part of the intestines.
Jean had gone and had a lap band operation done previously with another surgeon. And like some of the lap band patients, what she'd experienced was a frustrating cycle of having the band adjusted to a certain tightness and getting some difficult symptoms from that, only to have it loosened to make those symptoms go away, and then losing a little bit of weight and then gaining it back. And she has lost somewhere in the neighborhood of 2/3 of her extra body weight from the level she was at with the gastric bypass. 2/3 of the weight has gone away.
My friends comment that I have more pep in my step and I'm able to work more days in a row and longer hours and not feel fatigued.
I looked at the breakdown for the last 12 months and it appears that about 74% of the patients are choosing the laparoscopic sleeve gastrectomy. Most of the rest of the patients are choosing a gastric bypass. And we're doing very few lap bands currently, mostly because the weight loss just isn't as predictable with the lap bands and there are some long-term issues.
Go to the seminars, especially Dr. Marvin, who is very open, explains things in a very simple way for everyone to understand. We have numerous support groups here in Houston, and that has been my main success.